Hi athletes, it's me, Tracy, your fitness expert, your nutrition expert, and your coach. So I wanted to come on here quickly. You know, so I'm standing and not sitting, so it means that I might actually move. Okay, I wanted to come on this morning and I want to talk about these lovely things right here. Your deltoids muscles, also known as your shoulder muscles, also known as your purse holders as well too. They're very, very important to us, and we want to keep them strong and we want to keep them healthy. Now, I've been getting a lot of responses from some of you that are having some issues with your shoulders, and I understand that. And I really wanted to tackle that because inside of a gym, it is the number one injury inside of a gym because of poor lifting, as well as lifting too fast, too soon, and poor alignment. Okay, so I wanted to address that. First of all, there's three muscles to your deltoid. Your deltoid muscle is only about this big. It's a very small muscle. So when I see those guys inside of the gym and they're just lifting, and then all of a sudden, years later, people are having rotator cuff surgery, it's just no wonder. There's no reason for it at all. Your muscles, anywhere in your body, I want you to grasp this concept. Your muscles work in progression. If you go from 0 to 60 with working any muscle, there's going to be injury. So there's no reason at all to go from 0 and skip everything in between and let me lift at 60 to get more progression with the shoulders or any muscle. No, that's injury. I don't care how strong you are, you need to not do that. The muscle is not going to grow any faster. The muscle grows from, think of this is from faith to faith, glory to glory. So it grows within consistency, not with, oh, let me bust out a move right now and let me actually lift heavy right now because I want quick results. Our muscles don't respond that way. It responds with over time under tension, but also to the longer that you do it. If that was the case, if the case was you can lift it fast now and get the results, wouldn't I look like an Amazon woman because I've been doing this for 35 years, right? So it's a work in progress, and you will appreciate it more and you will love it more when it's like, oh wow, all this work and now. Whereas if it's like you're looking for a quick diet within your body, and that's just not the way that God designed our body. You want to be able to actually move within progression, okay? So I want you to grasp that and to know it. So some of you that I hear that are doing front lateral raises with 15-pound weights, I don't use 15-pound weights with front laterals. I don't use 15-pound weights at side laterals, because think about that. I want you to know this also. The way the body is meant is any time that you're lifting close to the body, close range to the body, you can probably lift a little bit heavier. Anytime that you lift more that your extremities are farther away from the body, you're going to have to lift lighter because you don't have this much support. So when someone tells me they're lifting 15, when I lift and I actually do a front lateral raise, this is how the body should look. My body should not look like this. Okay? So if I'm lifting and my body is going like this is watch the shoulder girdle. See here? See how it's moving up and down like that? So if I go like this, okay, there's more actually tension in the back and less in the shoulder. So cut that out. Same thing with side laterals here. The shoulder should be doing the work, not this type of work. So if you're lifting too fast too soon, and then all of a sudden a month into this, you come to me that you're actually having some shoulder pain, or 2 months into this, it's like, oh, you're pulling something. Listen, stop it. Stop. Depending on how you work the muscle and how you're doing the exercises, I might use 3-pound weights. They're still very effective. 3s and 5s. Watch me. If you do lift 4 and you do swimmers, baby, that's 3s and 5s. You may do an 8, do a 5, then do a 3. You have to listen to the body. If you cannot keep the form, you're doing it wrong. It's too heavy. You should be able to maintain. Now, you do hear Joe say, go heavy, but he also says, if you go heavy, but you can't maintain the form, do not go heavy at all, okay? If you're doing overhead shoulder presses, okay? Now, the work is done here. Watch this arm. I lift up. I'm pushing my palm to the ceiling, and I come back and stop here. This action does not happen at all, okay? The shoulder work is done here. Exhale up and inhale coming down. Exhale up, inhale down. Now, also too, what I want you to see is my arms are never directly here. You should be able to lift on a slight angle. That's anatomically correct, the way God made our muscles. Is this when I'm lifting overhead, I should be able to see my fingers in front of my face. Lift and lower. Lift and lower. Okay? And then upright row. Upright row sometimes is, it's a little bit difficult. People lift too fast because they want that jerking, okay? Effectively, to actually work those little, get those little roundness to the shoulders and everything, it's not about how heavy, again, it's the consistency. So I want you to think that when you lift, when you lift, your elbow should be higher than the shoulder, okay? So if you're lifting and jerking like this is out of alignment, and you want to look like this. So if I lift like this, and if you're causing to jerk, your weight is too heavy, okay? Very small right here and lower. I've had to tremendously decrease my weight on this muscle where I'm using 3s and 5s. You remember last year I talked a lot about that in my left arm I was having some tendonitis in my elbow, and tendonitis sometimes tends to shoot up. The best thing for me to do was to lay off of it. I actually rehabbed it a lot myself. Now, it is right now probably 97% better. But the one exercise, when I do upright rows, if you can see, sometimes I have a tendency to kind of favor here, and I have to make sure I'm not, okay? So I have a tendency, if you look, you can see a little bit how this shoulder raises up. So there's still a little bit here. And sometimes nursing, I don't want to call it an injury because this was not, it was not really injured. It was just actually, it was, if I did not notice it and start rehabbing it, it could result it into something more. Okay, so our bodies, the way God designed our bodies gives us signals when something's wrong. Okay, so Tracy, how do I know if I'm just sore or if I need to back off? Your first number one thing is, are you lifting out of alignment? If I'm lifting out of alignment, then you actually need to back off the weight. Okay, so you're going to, if I do an upright row, see if I do here, if you feel a little bit of a pinging, like I feel, well, I just finished working out too, a little bit of a pinging is there, then you need, see how my arm just does a whole funny different thing within my left arm than my right arm, okay? So I'm constantly stretching and rehabbing this arm because in Jesus' name, it is going to be 100% very soon. But I have to do my due diligence. If you are not doing your own due diligence, and what I mean by that is you've got to stretch it. You need to not, sometimes, if that means, again, sometimes you saw me even I may use a heavier weight in this arm and a little bit lighter in this one, okay? And I posted a whole video that's just on shoulder rehab exercises. Do those exercises. Don't just not do anything and think it's going to go away. So how do you know when you actually need to totally back off of it? Well, if you start doing an exercise and immediately you're not fatigued, but immediately you start doing an exercise and you're like, number one, that's a signal. Don't do it. Don't push yourself to do it. If you do an overhead shoulder press and you immediately you're feeling some pulling, you're feeling something really above a 5 in your shoulder, don't do it. You will be just as effective of doing exercises without the weight. You will be absolutely fine. Remember that muscle is little bitty, okay? And you probably have some inflammation inside of your shoulders, and you need to stretch it and you need to rehab it. Alignment is most important. So I want to show you something with front laterals. I didn't say this. With front laterals, remember this. So many times I see people doing this. You stop at the shoulder here. This is where, and anatomically correct, how God made your shoulders to stop right there, okay? Side laterals, same way. You see how I changed my feet position as well too? So if you're doing, you see this done a lot in Lift 4, they talk about changing feet positions. That's important. If for some reason you're just beginning to do shoulder work, and let's say if standing in this is your neutral alignment. Standing in neutral alignment, it's hard for you to do this and maintain your core stability, then switch to one leg forward, one leg back. Okay? You're just dividing up right there, your foundation right there, until you're able to maintain here. So if it's hard for you to maintain your core, which means is this is your maintain your core, okay? This is maintaining it. So if you find that by lifting your shoulder, even if you're lifting lighter, or if you're lifting this way and you kind of tend to stick that pelvis out, go ahead and switch. And sometimes you'll see me talking and I will just automatically do that because I'm going to show you more in an intermediate rather than advanced. Okay, so if I'm lifting to the side, stops at my shoulder. If you keep doing this, you're going to be contacting me and you're going to say, Tracy, my shoulders are hurting. I want you to practice something at home. Okay, this is the way. Remember, God made our bodies to move in certain ways, and when we are moving and doing exercises out of anatomically how God made us, you're bringing on some injury. So here's an example. People do, for instance, here, I'm going to do this one time and one time only. When I lift up and I keep going up, my palms, if you can see, my palms are facing down. Okay, so when I lift up and I keep lifting and I keep lifting, when I get to about right here, you should feel a tightening in here, okay? But people force themselves and they keep going all the way up, okay? See how my arm is forcing it down? See that? That means I'm rehabbing this arm, okay? But I'm just saying, okay? See, people, oh gosh, you feel that. That is not correct alignment. Okay, so I'm going to do it again in correct alignment. So if I go up, right when I get it right above my shoulders here, my palm is still facing down, okay? Now when you feel that pinging there, flip your hands over, palms are facing up now, and then go all the way up. See how you freely are able to do that now? That is anatomically correct. And this is one of the reasons why shoulders. So if you're lifting your arms overhead, so for instance, if I'm doing jumping jacks, you'll never see me do jumping jacks with palms facing down. My palms are always facing in because my shoulder girdle is open wide, and that's how my arms are able to flow. That's how God made us. Same thing, a lot of things within our hip joint. I'm not talking about hips today. I'll come back and I'll do a whole nother teaching on just the hips. But I'm talking about the shoulders, okay? One last thing let me stress about shoulders is that, listen, your own posture gives way to, and your own posture, how you stand, how you sit, and everything plays a part. I talked about this before. You have to be athletes in and outside of working out all day long. If you are like this, then you are actually giving way to having injury in your shoulders. So I want you to try more that your shoulders should be up, back, and relaxed. Hands fall to the side, not to the front. Hands fall to the side. You don't have to stand like robots, but that's just, standing forward here. Like that, okay? Shoulders back and relaxed, right there. Showing off those beautiful shoulders, right there, okay? All right, so I hope I answered questions. Some things also too, if you're having some different, one more thing. Not just lifting weights, but because predominantly all of our exercises are, you are doing the work. Your body is doing the work, is in doing planks, push-ups, and you're doing plank twist, and you're doing plank, and when you did Transform 20, and now you're doing MM100, all of these workouts, you are on here, which means is that your shoulder is stabilizing your entire body. So one of the reasons why you're having a lot of aches and pains is because your body weight on these stilts, these are your stilts. Your body is holding you up on those stilts, on your stilts. Your arms are holding up your body on your stilts. I think you know what I mean. So which means is that the stronger, if you're unable to hold that core, if you can't hold up your body, then if you need to modify it, modify it. But don't stay in modified. Every now and then push yourself, and then if you need to drop down. But just understand you're going to feel some tenderness because a lot of our workouts are your body is doing the work. So if you're in a plank position, if you're doing plank jacks, if you're doing now in MM100, we're doing all of these different things as in the bolt, and you're doing all those knee tucks and everything on your shoulders. You're going to have some slamming shoulders, out of it, but you want to protect them at the same time. So if right now you can't do all of them, it is okay to modify, and then when the core gets stronger, your legs get stronger, because sometimes it's not necessarily from the shoulders, it's because you're unable to hold yourself up. Okay, so that doesn't mean I'm not giving you a free way to just drop down and always modify. What I'm saying is you have to determine that yourself, and it is okay. And yesterday can be different from today. So I just want you to know that you're doing a lot of the work yourself, so you're up on those arms. If you need to wrap your hands, but as for what can you afterwards, take that recover afterwards. Make sure you're taking recover, and also to add turmeric to a lot of your food as well. It's going to help as an anti-inflammatory. It's going to help. I would love to show you another product that I take outside of Beachbody. This called a tissue rejuvenator. I've been taking it ever since actually running, and it's actually wonderful for the joints, but also to the recover also, and it helps so much within recovery of the joints also. Okay, I hope this helps, guys, within your shoulders of knowing that you're doing nothing wrong, but let's be preventive and not do anything wrong. Have a great day.